part of what we wanted to do in August was feature some presenters and workshops that had to do with higher education and issues that are impacting campuses, students on campus. Students get back probably like next week or the next few weeks. Students are coming back to campuses, and so we really wanted to focus on events and issues that young people care about that impact them. And uh, if you go to mobilizerecovery.org right now, you can actually see all of the events across the country. And so you can kind of check out the one that's closest to you, make some plans to attend, and RSVP on the pages. Um, so that's at mobilizerecovery.org. There's a huge map of the country, and it shows all the events across the country between August and November. And so please check that out to join us for in-person events because these monthly virtual trainings are fantastic and we love seeing you. But we also love the in-person sort of, you can't really replace that enthusiasm and energy that you get in in-person events. And so that's mobilizerecovery.org. Check out all the campuses that are hosting events. And also, I want to say if you are involved with a campus that's having some sort of recovery month activity or something in the fall that you want to put that on our map, you can do that. So you can go to mobilizerecovery.org and submit your event, and we'll feature it with the other events that are happening across the country so other people can find your event. Because we're getting a ton of traffic on our website with people registering. So I mentioned this is one of two this month. The next one is the last Thursday of the month, which I believe is the 28th, and that's all on collegiate recovery programs. And so I'm going to put the registration link for that in the chat for everybody. So if you haven't already RSVP'd for that, do that on that page so you can get the Zoom link and we can see you here in a couple weeks. And with that, I'd like to introduce our guest. I've known him for a long time. He's been mobilizing, I think since the first or second one, one of the Vegas ones. We met Noel, and then I recently got to see him present on the subject of the impact of opioids on higher education at the ARHE conference a little while ago, and we said, you know what, it'd be great to deliver this sort of presentation to our network virtually so people can see this. So with that, I will introduce Noel, and we also have uh, at the end of the presentation, we have like a really short feedback form that you just fill out and talk about what you thought about the presentation. And so I'll make sure that you all have that link, so watch the chat for that. So without further ado, Noel Vest.
All right. So I put in, thanks Aaron for the kind introduction. I put in the chat also just a website if you want to learn more about the work that I do. That's a pretty good website to get pretty much up to speed on some of the work that I've been involved with here at BU and then at other places as well. So I'm going to go ahead and start sharing my screen. So just first of all, I just want to say thanks to Ryan and Aaron and Garrett and everyone at Mobilize Recovery. In this first part of the presentation, I'm going to take some time to kind of like set the table, add some context to my interest in the fentanyl crisis as it really applies to institutions of higher education. So I'll weave in kind of a brief history of my journey from Washington State University to Stanford to Boston University into kind of an outline of some of the work that I've been involved with in this area and how I kind of got inspired to do more work in this area. And I'm one of those people that I like to do questions at the end, but I always like to tell people if there's something that I didn't answer or something that is not clear, feel free to stop me and ask for clarification. Or if there's, a quick question that you might have that you feel like you might forget, feel free to interrupt me. But otherwise, I'll answer, and hopefully we'll have a really robust question and answer period at the end, because I'm really hoping to open it up and hear what other people have to say. So I always start out with this slide. I always like to give a really big thanks to my family and to my wife. Without their help, I would definitely not be here today. As far as my disclosures, I am supported by the National Institute of Drug Abuse. I have an early career award to study nothing other than collegiate recovery programs. I also have a loan repayment program through NIDA. I serve on the board of directors. I'm actually the board secretary for a nonprofit out of Seattle, Washington called Civil Survival, though it doesn't have any financial interest at all. And I don't have any conflicts of interest to report. And so, as Aaron mentioned, I'd like to start out with this slide. This is not my first rodeo with Mobilize, so I was there in the very beginning. I attended the very first Mobilize recovery way back in Las Vegas, and I believe it was in 2019. And then alongside Aaron, I helped start the California version of the Recovery Coalition that we started kind of during COVID and got that off the ground with Garrett and Aaron and a whole bunch of other really cool advocates when I was living in California. And so I also like to just kind of talk a little bit about my journey through addiction. Like many people with addiction, my journey kind of roamed through or was funneled through the criminal justice system. I entered prison in 2002 and actually started entered long-term recovery while I was in prison. I was really lucky that I was at a prison that had both mutual help group meetings that they offered, which is where I got my start there, and I was also at a prison actually in right outside of Las Vegas, Nevada, that had a college and prison program, and so I was able to take advantage of some of the college classes that they offered through the College of Southern Nevada. And those classes are actually still on my transcript today. And when I look back at my transcript, those are the classes that I'm actually most proud of because they were the beginning. They were kind of like the beginning of realizing that maybe a journey through higher education would be possible once I was released. And so I was released in 2009 and spent the next 12 years of my life traversing the road of higher education in spite of a multitude of collateral consequences that come with a conviction history. I started at a small school called Columbia Basin College in Pasco, Washington, and then I transferred to Washington State University in Tri-Cities, Washington. And then I was accepted into a PhD program at Washington State. This time in the campus in Pullman, so the kind of the mothership campus in Pullman, Washington. So in the year 2014, I start at the age of 43 years old. I started a PhD program, and this picture is my first day getting off the bus at Washington State University. While I was there, I also helped pass legislation that removed the criminal history box from college applications in this, at least in the state of Washington. And alongside John Wallace, who's in this picture with me, I helped found a collegiate recovery program that is still going very, very strong today. Patricia Marheis is the faculty sponsor for that program. But like all good things must come to an end. My time at WSU ended in 2019, and I went on to do a postdoc at Stanford University, Stanford School of Medicine in Palo Alto, California. This was actually the very first time that I was actually specifically chosen for a job because of my unique journey to higher education. And so I worked with a gentleman there named Keith Humphreys, so who, for anyone that has done research in this area in the last 25 years, you know his name very, very well. He's really kind of written the book on, him and John Kelly have kind of written the book on research in this area. The reason I also note this is because this is about the same time that I started to hear about fentanyl on campus. Before this time, I had never really heard of. I mean, I had heard of fentanyl, but you know, for the most part, I had thought of it more of a as an East Coast drug. I was living on the West Coast, and we hadn't really heard much about fentanyl at that time on the West Coast. And so this is my first personal experience. When I was at Washington State University, I became a big fan of the football team. And in early or in late 2019, early 2020, I had my first, I would say, personal experience with fentanyl, in that one of the Washington State players had died of an accidental drug overdose, including fentanyl. And so that's when fentanyl really kind of became on my radar, and I realized it wasn't just an East Coast problem, that it was kind of a West Coast problem. And so this is the first paper that myself and Chelsea Shover, who was my lab mate at Stanford, we wrote this paper. What happens with the CDC data, which is like the official data for overdoses, the CDC data ends up coming way too late. So we end up learning basically 2 years later what the opioid overdose rate was 2 years before. And Chelsea had this, premonition that fentanyl was much more prevalent on the West Coast than what was being reported. And so what she decided to do was actually to go into, not rely on the CDC data, but to actually go to every county east of the or west of the Mississippi, every county coroner's office, and count up all of the fentanyl deaths that had happened. It was a very time consuming process, but it allowed us to really kind of shine a light and really start getting people to pay attention that fentanyl wasn't just a problem on the East Coast, that it was a problem on the West Coast as well. And so this paper came out in early 2000, and then fentanyl really started to hit home, because right on campus in February of 2020, right before COVID hit, there was a on-campus overdose death in one of the dorm, or in one of the fraternities at Stanford. One of the students died of a fentanyl overdose. And so along with this, these two students, Nicole Takia and Max Moss, they were two Stanford students that were friends with Etienne, the gentleman, or the young man that died. And they were really, really, really upset about losing their friend. And more importantly, they were not only upset about losing their friend, they were upset that they just didn't feel like Stanford was doing enough at a system at the school level to address what had happened. So they reached out to me and asked if I'd be willing to mentor them in their efforts around this issue. And I told them that I would be honored to help them out. And so they basically did a whole bunch of research, looked around to find out what they could find out about trainings. And within the next few years, these two students had a really lasting impact at Stanford. And so Nicole, now a medical student at Stanford, and Max is now a medical student or in medical school at Brown. So they both moved on. But again, they've had a really lasting impact, not just at Stanford, but they had a really lasting impact on me as well. And so one of the great opportunities that I had when I was at Stanford is that as they were getting ready to come back after COVID, as students were getting ready to come back on campus after COVID, they were starting a substance-free housing unit at Stanford. And so this was the house that was going to be used as a substance-free housing unit. And they asked my wife and I to be resident fellows of that substance-free housing unit. It's called the Well House. And it was the first house to actually have Narcan available to all students and staff in the units, or all student staff. And the other thing too is that because this was like the hub of the collegiate recovery program, we were also able to hold Narcan trainings weekly for any student that wanted to be trained how to use Narcan. And then the next year, the Narcan training was mandatory for all student staff in every single housing unit. And so again, this was the lasting impact of two students that um, really wanted to make a difference after losing their friend. And so it really got, I think, motivated me to really want to learn more about, the impact that I could have. And it really kind of impacted the work that I was doing. Not only did they have a lasting impact at Stanford, but their work also led to Senate Bill 367 and the Campus Opioid Safety Act. And again, this is all based on their work. And so from this point forward, I really have been super interested. I recently moved 2 years. I say recently, it's 2 years now. I moved on to a faculty position as an associate professor or as an assistant professor at Boston University in 2023. This is where I now live. And so hopefully this just gives a little bit of context about kind of my initiation with this particular topic, why it's really, really important to me, and kind of some of the background of what I bring to this work. So I'll jump into the presentation. When the first year that I was here at BU, I was invited to be on a dissertation committee. This is the person that invited me to be on their dissertation committee. This is Christina Freibot. She is an incredible researcher interested in, she was doing research in opioid overdose and was really interested in doing work on naloxone in college. We have the principal investigator for a large data collection project within colleges at BU. Her name's Sarah Lipson. She runs the Healthy Mind Survey. And so Christina was very, very much so a part of that. And so really with most of the stuff that I am presenting today, I'm really just her collaborative partner for much of the research that I present here. Much of this work was work that she led, and I just got to be a part of it. And so that's the great thing about having graduate students, is that they get to do all of the hard work, and I just get to kind of oversee and help them along the way. And so this was a really great opportunity for me to get here. All right, so the fentanyl crisis on college campuses. So we'll start off with just a little primer on kind of how we got here. I think most people have probably seen this slide before. This is a really common slide that a lot of people show in their presentations. We know that more than 1 million people have died since 1999 from drug overdose, the main driver of which is opioids. We generally talk about the opioid crisis as described, typically it's described as evolving over 3 overlapping waves. And I would say that there's actually now an emerging 4th wave. So each wave kind of coincides with a shift in predominant opioid form of use. And so all of this kind of remains relevant and crucial in understanding and addressing the crisis. And so for people that aren't maybe familiar with this slide, what this kind of shows is the first wave of the opioid crisis, which was kind of surrounding prescription opioid pills and overprescribing of prescription opioid over prescription opioid pills in the late 1990s and then in the early 2000s. And then you saw this kind of the second wave began right around in 2010, where they started kind of repealing and reining in some of the prescribing practices. And you saw an increase in overdose deaths with heroin, including a fivefold increase in heroin overdose between 2010 and 2016. And then you see this third wave beginning in 2013 with significant increases in overdose deaths involving synthetic opioids. And primarily what we're talking about here is fentanyl. And then this fourth wave, which is indicative of kind of a broader shift in the crisis where opioids are being used in conjunction with other substances, primarily with stimulants, both cocaine and psychostimulants, methamphetamine. So it's kind of the polysubstance use wave that we're kind of experiencing right now. So one demographic of particular concern in the opioid crisis are adolescents and young adults due to their potentially compounding effects of opioid misuse early in the lifespan. And then adolescents and young adults are deemed kind of a priority, or due to their compounding effects of misuse early in the lifespan, they are kind of deemed a priority population in the opioid crisis. So despite an overall reduction in overdose deaths in the last couple of years, the rate of unintentional death or overdoses for young adults is actually increased. And so we're seeing, again, an increase in young adults. This is primarily due to the increased presence of fentanyl in the illicit drug supply, including sometimes in contaminated or pressed pills, which is what happened to the student at Stanford. And we're seeing that overdose deaths in that age range have tripled, or involving fentanyl at least have tripled. And so despite this increase in overdose fatalities among young adults and adolescents, there is limited public health research at the national level to inform education and prevention efforts. So this kind of sets the table for what we'll be discussing here. Colleges or higher education settings are really important. Over 20 million young adults are enrolled in U.S. colleges, and it makes it an ideal setting to employ these upstream prevention strategies for opioid misuse. Many colleges have existing public health focused programs such as bystander sexual assault training, suicide prevention, substance use education programs. It really makes it easy for these places to kind of instill or install these other public health programs. So these programs vary in content and methods, but they share the same common goal of preventing a multitude of short-term and long-term negative outcomes and improving the well-being of adolescents and young adults in this college setting. And so I already mentioned this this death, or the Stanford death. This is just one of many deaths. And I think the important thing to understand about each of these deaths as they happen on college campuses is that almost always each one of these deaths is followed by a multi-million-dollar lawsuit filed against the university. And these universities end up paying very, very large sums of money because, in essence, they're not prepared. And so we see more and more examples of these kind of making very, very big headlines in the news. And these deaths and the media fallout negatively impacts universities. Lawsuits follow, insurance payouts. And what will happen in the language of these lawsuits is that the schools are forced to implement changes. they're forced to implement some kind of strategy so that this doesn't happen again, so that another person's family doesn't have to live through this kind of horror again. And so as a result, what we're seeing these forward-thinking states, many of them own, many of which own these universities, these public universities, are now trying to kind of front load strategies to save money. So they're investing in these strategies to reduce overdose deaths. And so this is really kind of this project that Christina did, and this project that we're also going to be proposing is really kind of based on this notion, is that we really, these schools are being forced to do something, and they have no idea what best practices are when they're being forced to implement these changes. So this is just an example of seven. There are 7 states. This particular example comes from the state of Washington, but this is just one policy response. This was back in the 2024 legislative session. So Washington, along with 7 other states, passed laws relating to opioid overdose and education or access to opioid agonists such as naloxone or Narcan. And these laws really kind of vary in scope and content, with some kind of requiring access to opioid antagonists, while others just kind of mandate education and training for students. This, again, is an example of a law from Washington State. And as you can see, it's focused on institutions of higher education. And so that gets us into the meat of what I'm going to be presenting. So these are 3 different projects that Christina did during her dissertation. The first is a scoping review. So this type of review, the reason that they call it a scoping review is because it's all encompassing. There are different kinds of reviews that you do in research. Probably the most common is a systematic review. A systematic review, what you will end up doing is actually taking a whole bunch of statistical analyses and combining all of the statistical analyses to come up with kind of this lump sum statistical analyses. That's not what this is. A scoping review is just to find out. We want to do a very broad search of all different kinds of articles that we possibly can, and we would just want to find out what's going on. We know that there's not even enough evidence out there, or there's not even enough research with statistical outcomes that we could even do a systematic review right now. So we employ one of these scoping reviews. And so this scoping review was really kind of informed by the continuum of care. You can think of the continuum of care really for any disease, right? This is not just particular to substance use disorder. You can think of any disease, how generally they break up funding for these problems in our society, or how they break up the money for these, is they have a kind of a chunk of money for prevention. They have a chunk of money for identification or assessment of these diseases, and then they have a chunk of money for treatment of the diseases, and then they have a chunk of money for recovery of diseases. And so when we think about that in the context of substance use disorder or opioid use disorder, there's no difference, right? So we have kind of early primary prevention, we have early intervention, we have treatment, and then we have recovery supports. And so we felt like this is a good way to kind of break up the scoping review into categories that we could kind of talk a little bit about. And so this just kind of provides a foundation for this scoping review. And so when we look at these results that are categorized, we found a total of 46 peer-reviewed articles that touched on opioid. I'm going to call it OEND, right? Opioid education and naloxone distribution. But OEND is a specific type of evidence-based intervention to reduce overdoses. And when we looked for that on college campuses, we found that There was 28 articles kind of in the prevention side of things. There was 10 articles in the identification part of the continuum of care, and then there were 6 articles in the treatment part of the continuum of care, and then just 2 articles down in the recovery side of the continuum of care. And this makes sense because we think of overdose education really more as a prevention effort. Though there are a lot of collegiate recovery programs that are really doing this work. I think they've taken the lead on most college campuses in doing this work. But this is how they kind of broke down. This is just a summary of the main findings. They really kind of include this need to develop campaigns that focus on prevention and most commonly employing this. The biggest problem was that the most common way of looking at these things were using some kind of cross-sectional survey design at one single institution. And so we didn't really have a great idea of any kind of long-term effects of these. And then, as more college students are likely to engage in prescription drug use, if they perceive it as kind of normalized within their peer group was another thing that we kind of found. One of the most increasingly common approaches was using these or pairing with these AEDs in really prominent places within dormitories and within fraternities and sororities, were creating these urgent emergency response areas, or sometimes you'll see them as emergency response boxes, but really just making sure that naloxone is available and accessible in every dorm or in every living situation. Another thing that they felt was really important was making sure that buprenorphine is available to the students that may or may not need it as a medication for their opioid use disorder, and then making sure that student health services had both MOUD and 12-step recovery services or programming along with it. So the next project was a policy tracking database. And again, this was primarily done by Christina. This really kind of furthers the landscape of higher education and response. This policy tracking database was created really to kind of capture the presence of or absence of opioid related policies at colleges and universities across the US. And so all of the universities, there's well over 100 universities that participate in the Healthy Minds Survey. What the Healthy Minds Survey asks all these schools to do is to send them, every school has to have, as part of the Safe Campuses initiative, all of these schools have to have some kind of written policy statement or written policy about how they plan to deal with drugs and alcohol on their campus. And so they ask all of these universities to send them their policies relating to substance use on campus. And so what this policy scan did really was take all 100 of those policies and do a deep dive into their Good Samaritan or medical amnesty regarding overdose, what they provided as far as overdose prevention, substance use disorder treatment, naloxone training and access, and this is what was found. So what they found was, or what Christina found was, 51% of schools had some kind of Good Samaritan law or medical amnesty policy, meaning that if you were to call in an overdose that you witnessed to the EMTs or to a medical professional, that you would not be then charged for that, or not be involved in any kind of police intervention for that. 27 of schools described some kind of options for substance use disorder treatment. 22% had naloxone on campus. 18% offered naloxone training, and 16 had an overdose prevention program at the school. And so this was the results of that policy scan. And then we wanted to understand or get a kind of a current snapshot of overdose knowledge among college students. And so we added questions to this Healthy Minds survey. Again, over almost 90,000 students participate in this survey every year. And we wanted to kind of capture these outcomes. And so what you can see on the right-hand side is the questions that were added to the survey. So we were interested in understanding knowledge around Narcan or naloxone. And what we found was that 14.2% knew how to administer naloxone. So under 15% actually knew how to use naloxone. 30% can correctly identify naloxone use. 62% correctly identified at least one sign of an overdose, and almost 70% felt comfortable calling emergency. There were some significant differences by age, race, and ethnicity. But again, I think the most important part of this finding was that less than 15% of students knew how to give Narcan. And so this was a subsample of that Healthy Minds survey. Like I said, there's about 90,000 in the main survey. This was a subsample of just the substance use disorder module. But again, a huge sample when we talk about college students, almost a little bit over 7,000 participants in this particular study. This study came out or was published in JAMA Pediatrics a couple of years ago. And again, is one of the first ones to really identify that this was a gap in our knowledge. And so I'm gonna kind of this last paper really is just a qualitative paper. I want to make sure that we have enough time at the end of the study or at the end of the presentation for questions. So I'm just going to kind of breeze through this last study. What this slide is showing is the first one is all of the Healthy Minds data collection universities across the United States. What the green and red show are the schools with some kind of OEND programming and schools without OEND programming, because we felt for this stage of the study, it was important to have both schools with and without some kind of overdose education currently happening. And then these were the final sample. So you can see that there's about 14 schools with policies and 11 without. And what we did is we just did a real basic qualitative interview, and we looked for themes that were kind of coming out regarding overdose education and naloxone distribution on campus, and some of the issues with OEND on campus. And again, I'll just kind of breeze through these. I'll just kind of read you the themes. The first theme was this shifting narrative of opioid misuse and overdose to broaden the support for campus. And so what they mention is that, changing the name from opioid overdose to opioid poisoning sometimes would soften the language that people and administrators would feel a little bit more comfortable with. The next theme was internal and external advocates for implementation. I think with any of these kinds of anything really on a college on a college campus, if you want it to be successful, any kind of initiative to be successful, you have got to have leadership bought in at the very highest levels of the school. That's one thing that I've noticed, and I've been in higher education for quite some time now, is that if you don't have buy-in at the very top level, it's not very likely that your intervention or whatever you're trying to get done is going to get a whole lot of political will to support it. And so that high level buy-in is really, really important. The other thing that we note that was noted was this collaboration. So collaboration both on and off campus with providers of naloxone. Sometimes schools had to partner with county health departments because they couldn't give naloxone away themselves. They had to partner with these agencies. So learning how to collaborate was really, really important. And then the last theme was this idea of varied breadth and depth in approaches to overdose prevention. So most of these schools were operating on what I would call a shoestring operation. So they had no money to do anything, and they had no infrastructure to do anything. So really trying to find, interventions that were going to work at those schools, plus at schools that had kind of much more robust programming. We're already offering some kind of programming around OEND, but just making sure that you're able to kind of fill all the gaps and not just work with low resource schools and high resource schools, but the breadth of all different kinds of schools. All right. So as I mentioned, Christina finished their PhD, and all good things must come to an end, unfortunately for me. But then again, they sometimes they begin again. And so Christina accepted a postdoc position working in community health sciences right along with me in July of this year. And so we're really, really looking forward to taking on the next steps of this line of research. And so I'll kind of show you what that is here at the end, a little snippet into what we hope to do. These are some of the key takeaways from all of these studies that we learned. There's this major focus on prevention, often using cross-sectional surveys. This is one of the downfalls to the current evidence that we have. It's not very robust. Again, nearly 2/3 of college students are willing to intervene despite having low opioid-related knowledge. And this idea of phased implementation and ongoing adaptation of opioid overdose prevention programming is really, really key, and kind of bringing things in kind of one at a time or in a stepped approach is really, really important, and not trying to overdo it all at once. So what's next? I'm gonna talk a little bit about my home state of Washington. I think that they are really kind of leading the way in this area, and so this is a budget, or this was a bill that was passed last year, 2024. I mentioned it earlier. This is HB 2112, and really it provides for all four of these types of interventions, and schools are brought into compliance. You have to be in compliant with each one of these mandates that has been mandated by the legislation at the school. And so my alma mater, which I'm incredibly proud of, Washington State University, is again really kind of leading the way, doing a lot of prevention work, a lot of naloxone training. They're doing it once weekly. They're working on getting naloxone in every fraternity. Obviously, the work that's being done at Stanford is really above and beyond. Ralph Castro at Stanford has really, I think, taken it upon himself to really champion overdose education and naloxone distribution on that campus as well. So what's next for me? As I mentioned, I'm working on a large NIDA grant to hopefully identify which of these implementation strategies may lead to better uptake of OAND in these higher education settings. And so to give you a brief breakdown of what we're hoping to do with this grant, and I promise there's no statistics in this at all, but what we're hoping to do is, this is kind of a really new way of doing research. These innovation tournaments are kind of groundbreaking. They're very novel, at least within the research field. And so the idea is that we want to take these really, really diverse sets of schools. So we want to kind of stratify schools by whether they're public or private, rural, or how big they are, small size, big size, whether they have current OEND practices, whether they don't. Um, uh, and we really want to understand, we're going to recruit 12 schools to do this innovation tournament. And how this works, I know that this looks really, really funky. It's actually a really cool picture. But how this generally works is that we want to develop as many ideas as we possibly can with this. And so we want to we want to understand, not just ideas at the student level. We want to understand them at all levels of the school stratosphere, right? So administration, faculty, we want to open it up to anyone that has any kind of ideas, and we want to turn those ideas into tangible strategies with the help of a challenge committee to do that. So what we do is, at this stage right here, while we're trying to identify ideas, is that we send this out or we send this an email with this question out to as many people as we can, to try and garner their ideas around the best ways to provide overdose education. And so it's really a crowdsourcing technique, because we want to learn from people on the ground how best to do that. The idea is then other people that have created ideas will then rate other people's ideas, and then as a research team, we'll kind of consolidate those ratings, and we'll give a list. We'll create this list, this top-down list of the most well thought of ideas, or the highest rated ideas. From there, in aim 2 of this study, we're going to take these we're going to turn these ideas into tangible strategies with the help of what's called a challenge committee, or an innovation tournament committee. And these two will be lived experience experts on implementing these college health challenges. So what we'll end up doing is taking those ideas, refining them into implementation strategies, and then those strategies we will take and do a step wedge design where we do 2 schools at a time. So we'll introduce these strategies at 2 schools at a time. So 2 in the fall, 2 in the winter. We're very constrained by the school year when we talk about very large studies for school. And so we'll do 2 in the fall, 2 in the winter, and then 2 in the following fall. And we'll do that. We'll do the intervention will be those implementation strategies. And we're going to measure at baseline, we'll measure at midline, or basically right after the intervention is implemented, and then we'll follow up 3 months later to make sure that the information that we're instilling people is sticking. And with this, we are going to examine the effectiveness of this. We're going to examine some implementation outcomes, and with the hope that we kind of fill this critical gap in overdose prevention that we currently just don't know what works best regarding OEND strategies on campus. And with that, I've got about 10 minutes, it looks like, for questions. And so if anyone wants to reach out to me, my email is right there. You can also, if you click on the thing that I put in the chat, that's got a link of how to get in contact with me as well. And I'm very easy to find on pretty much every kind of social media that is out there. Those are just 2 of the ones that I primarily use to promote most of the research that I do. And so with that, I'll go ahead and stop sharing.
Awesome, Noel.
And open it up.
Yeah, thank you so much, Noel. Yeah, so if you have a question, you can wave and I'll take you off mute, or just take yourself off mute, or virtually raise your hand to ask Noel a question. And thank you, Noel. It definitely reaffirms why we're doing work on campuses in the fall. So I did drop the feedback form in the chat as well if you could take a minute to do that. But yes, we have a couple minutes for questions. And so who's got a question for Noel? Just, yep. Hey, Nick. Oh, I think I muted you after you took off your, go
Yeah,
ahead.
no, I was just wondering, is there any, well, two questions. Is there anything as far as like DARE on a collegiate level as far as drug education? And number two, is the federal funding that's being cut affecting this on the collegiate level as well?
Yeah, two really, really great questions, kind of separate questions. As far as DARE, not that I'm really aware of, not on college campuses. That there are, there's the college aim stuff that is kind of more of a harm reduction type of intervention. There's basics work. I don't know what, I can't remember exactly what that stands for, but those are interventions specifically, and I would say they're more geared towards harm reduction kind of intervention for college student, and they're mainly geared towards drinking as well. But as far as I know, no, there's nothing really like DARE on college campuses. And then the second question that you had was regarding, what was it regarding again?
Funding, the national funding.
Yes. So yes, the reductions in funding are definitely affecting collegiate recovery programs. I can just name a few of them. The state of North Carolina is one of the few that has state level funding. I think that funding is definitely in jeopardy. The program at University of Denver was just cut. The program at University of Windsor up in Canada, I don't know if it was cut, but they lost a big chunk of their funding, and now are having to do kind of a crowdsourcing funding drive, GoFundMe kind of a thing to try and keep their program afloat. And my old school at Stanford, the Collegiate Recovery Program director, the director's role was actually just cut out of the budget. And so we're definitely seeing it affect college campuses. As far as it relates to OEND, again, what I find is that these are really knee-jerk reactions due to overdose deaths on campus. And generally when they happen because of those overdose, they're pretty long-standing. They're not something that generally goes away. Once you kind of write something into an agreement, a lawful agreement that this school has to abide by as a result of this litigation, they pretty much kind of have to stick to it. So they kind of have to find ways to fund it in those situations.
Mm. Awesome. Thank you, Nick. Who else has a question for Noel? Go ahead, Sal.
Hi, everyone. Thank you both for talking to us and educating us a little bit on this topic. I wanted to ask. I also work for a small nonprofit agency in New York. We do station at schools prior college level. I want to ask if you see a difference, when students are like starting to learn about these things at an early age, in different demographics, I guess that is the question too. And are there any sort of peer support at a collegiate level as well? Like, is that offered? Because I know that is offered for young students, for teenagers. So we recently did this Teen Intervene, and so is there any sort of support when it comes to college level education?
Yeah, so I'm going to put in the chat for you a couple of things. I'm going to put in a couple of peer-reviewed journal articles, just some literature basically on some research literature on kind of what is happening so that way you can kind of read what's out there yourself. And I'll just kind of say that I think it's perfect that you're offering the 1 and 2 weeks is on collegiate recovery, because I think that's one of the best forms of peer support that you really have on college campuses. It means something a little bit different from what I have figured out, is that it actually means something a little bit different on college campuses. But all three of these studies, where is it? Yeah, actually, I'm just going to put two of them in there, but both of these studies are kind of talking about the Callahan study, or the Callahan paper is really kind of policy paper, really advocating, not even at the college level, it's advocating for OEND kind of things at the high school level as well. And so, anyways, there's a lot of I think work kind of being done behind the scenes. I think that it is important. I think that, and I didn't really mention this, but there's spillover effects, right? It's not just the college, it's the surrounding community that the college is in. You're training kids how to use naloxone. They're going to be able to save people in the communities that they live in, and the communities that they go back to as well, right? This is a lifetime training. I always tell people, for me, OAND training and naloxone distribution is, having people carry naloxone, it's like CPR, right? You're training them just as you would train them as CPR. This is something they're going to take with them for the rest of their life. They're going to be able to save someone's life for the rest of their life. So even though it's a very small incident type of a thing, it's huge payoff, because you're saving someone's life. And so I say, if you're advocating for CPR, you should be advocating to be done everywhere. You should be advocating for OAND to be done everywhere, because you're going to be able to save someone's life.
Yeah, Noel, can you drop the bill number for the Washington State? So yeah, when you're talking about like there's different things that people can advocate for on the state level legislatively, like having Narcan on college campuses. I'm working in South Carolina, where I live, to get Narcan in high schools. In New Jersey, when I lived there, we passed a bill that said if 15% of the students that are enrolled in that college or university, if they live on campus, then you're required to have some sort of collegiate recovery program on the campus.
Yeah.
And so like there are these different model legislations. I know a couple of them. If you go to Recovery Advocacy Project, which is recoveryvoices.com, there's some model legislations there with some of this like Narcan on school type of legislation that has passed in other states. And you can work with your legislators to get it introduced in your state. And then I was going to ask Noel, like, if people, it's like, how do people figure out like what the overdose policy is, like overdose prevention policy is on their campus, and like how to get involved in, like, is there like model sort of policies on campuses that they can find?
Yeah, that's a really good question. I think that's actually a really good question for Christina when she comes in a couple of weeks. I think that she might have a little bit more insight as far as
Okay.
just model schools. I mean, yeah. Here's another. So I put one in the chat. I'll put this one in the chat as well. Trying
Yeah.
to think.
I'll,
So the other paper that I put in there is that Hill paper. That is actually an implementation project that was done at University of Texas. I think that's pretty. I mean, that's pretty much what people use. The other thing that I would steer people towards is it's not specific to OAND in colleges, but the Healing Communities study is, I mean, it is just packed with information, and a lot of information on OAND. It's really, 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 I mean, again, I'll just put this in the chat, but it really is, there's so much good information if you just Google search Healing Communities. because that was a huge, very wide community project. It was done in 4 different states. It was very, very well funded. And so if you're looking to kind of get off the ground as far as what you can do, I think that just looking at their model language is really, really good.
There's also an organization for people to check out. It's called End Overdose, and so they End Overdose
Yeah.
also has different chapters on college campuses. And so while you're speaking, I was thinking about they're one of our partners for the fall, um, and so if you're connected with a campus and they don't have an End Overdose chapter, like check them out and see how you can go about creating. That's a student-led chapters, and so.
Yeah.
Um, Awesome. Thank you all so much. If you haven't taken the feedback form that's in the chat, just for your feedback for the workshop, and all those materials, Noel, like the articles and stuff, just send those to me, because what we'll do is we
Okay.
put all these workshops in a Google Classroom, and then we'll have all the supported materials with it. And so just send
Yep.
me everything on it, and we'll put it all together for everybody. So thank you, everybody. Our next one is August 28th. Noel, that was fantastic. I appreciate you getting folks ready for our campus sort of stuff going on in the fall. Thank you so much. I appreciate you.
Yeah.
Thank
Take
you,
care,
Sarah.
everyone.
All right,
Thank you.
everybody. Stay safe. Bye,
Thank
everyone.
you. Good night.
Bye.
Thank you. Good night.